Okay, let's take some time to focus on some facts here. These are basic facts that are published all over the internet and in medical journals. H. pylori infections are one of the most widespread known to man, with 75% of the world's population infected right now. That is over 4.6 billion people. And according to current statistics, this means that over 820 million people alive right now will develop stomach ulcers caused by infection of H. pylori. The World Health Organization also reports that over 50% of new gastric cancer patients are infected with H. pylori. Like I mentioned earlier, H. pylori is a very widespread problem. Yet this is no reason to worry. You are in good hands, and the good news is that there is a solution. H. pylori is not difficult to get rid of, but with this type of infection, it is very important that it is treated correctly. I'll get to that in a minute. If you suspect that you are infected and you haven't been treated or tested for H. pylori yet, then it will be a good idea to listen to the most common symptoms of H. pylori that I'm going to share with you now. If you feel you are experiencing any of these symptoms, then we recommend you ask your doctor for a diagnosis to make sure. The important thing to remember here is that H. pylori symptoms will differ from person to person, and that it is quite common for people to experience 3 or 4 of these symptoms all at the same time. Here are the most common symptoms, and they are in no particular order. Heartburn or acid reflux, diarrhea, constipation, flatulence, bloating, fatigue and low energy, nausea and vomiting, unplanned weight and muscle loss, or difficulty losing weight, hormonal symptoms including mood swings and PMS, depression and anxiety, gum disease, bad breath, and other oral infections, blocked nose, painful sinuses, and lastly, colds and infections. Maybe you can relate to one or more of the symptoms I've mentioned. At least now you know what causes these, and I hope that just knowing this comes as a small relief to you. So now you may have been diagnosed with H. pylori, and some of the symptoms I have just mentioned may have checked out with you. But what about the symptoms you may experience if you have a stomach ulcer? If you suspect you have an ulcer, then this may be fairly easy to confirm because there are fewer ulcer symptoms than H. pylori symptoms. Here are the 3 most common symptoms of all types of stomach ulcers: abdominal pain, heartburn or acid reflux, or abdominal discomfort, normally felt 2 to 4 hours before or after meals, depending on the type of ulcer. If you have any of the above symptoms, you most probably have a stomach ulcer. And if you have a stomach ulcer, then there's a 90% chance you'll be infected with H. pylori as well. Now that you have all the facts, I want to put your mind at rest by showing you that no matter what else you've heard about ulcers and Helicobacter pylori, there is a solution, a really safe and effective way to get rid of both H. pylori and any stomach